for most people, the ketogenic diet is a much healthier intervention than conventional medication-only treatments. Psychiatric medications in general and antidepressants in particular have a rather disappointing track record of bringing people a substantial relief from their symptoms. And the relief that some do experience all too often comes at the expense of significant side effects that can take a serious toll on quality of life, including weight gain, apathy, fatigue, and sexual side effects. So what I love most about prescribing ketogenic diets in my work is that instead of spending half of my time warning about medication side effects and managing those medication side effects, we get to look forward to side benefits. Instead of high blood pressure, higher blood sugar, higher triglycerides, higher appetite, we can see in most cases, lower blood pressure, lower blood sugar, lower triglycerides, and better appetite control. Instead of brain fog, and you can see mental clarity. Instead of sedation, you can see increased energy, etc. So, using nutritional and metabolic strategies in my work has completely changed the way I feel about practicing psychiatry. And it completely changes the way my patients feel about their symptoms. Maybe it's not genetic. Maybe it's not all about their childhood. Maybe it's not a character flaw. Maybe at least in part, their suffering has a biological and potentially reversible cause. Ketogenic diets have been shown in scientific studies to address many common biochemical features of psychiatric conditions. They reduce inflammation and oxidative stress. They support the growth and maintenance of new brain connections, so-called neuroplasticity. They help stabilize neurotransmitter and hormonal systems, and they provide a safe, clean source of fuel that burns beautifully, even in the insulin-resistant brain. It's true, we do not have enough clinical research yet to tell any given patient how likely it is that a paleo or ketogenic diet is likely to help them with their particular diagnosis. So what I tell my patients is this, we don't know what's possible for you unless we try. So with that in mind, let's summarize a few key points. If you yourself are struggling with mental health issues, a paleo diet is an excellent and universally safe starting point for any human interested in improving brain and total body health. It doesn't require any special medical monitoring, even if you're taking medications. However, if you have insulin resistance, a paleo diet may contain too much carbohydrate from fruits and starchy vegetables to bring glucose and insulin levels into a healthy range, which is where low carbohydrate diets can be so helpful. A ketogenic diet is also usually the next logical step if a paleo diet doesn't help or doesn't help enough with your mood or concentration issues. If you're considering embarking on a ketogenic diet, it's very important to learn more, to consult with a keto-savvy clinician first, especially if you have any health problems, have serious psychiatric symptoms, or take medications of any kind. There's more information on my website, Diagnosis Diet, and in a guide I wrote to low carbohydrate diets and mental health that I wrote in collaboration with the team at Diet Doctor on their excellent website as well, dietdoctor.com.